between the members of the Philadelphia community and the researchers of Jefferson Health and Sidney Kimmel Cancer Center. I also want to thank Julie Nelson and the Senior Center for hosting this event and providing this space and the wonderful food for everyone. Finally, I would like to extend a thank you to our presenters for coming. The purpose of this event is to bring research and community together, to not only give you an idea of what is going on at Sidney Kimmel, but to give the researchers at Sidney Kimmel an idea of what you as a community are thinking. The speakers here today are going to touch on some research that has been going on and is currently underway that is important to older adults. First, we will have Leila Mahdi, she is an assistant professor in the Department of Otolaryngology, Head and Neck Surgery at Thomas Jefferson University. Her practice specifically focuses on patients with head and neck cancer and reconstruction. She is Lebanese, first-generation American, and so naturally, she loves to cook and eat for fun. To make up for all the eating, she also likes to run, especially in the trails of Wissahickon. Next is Dr. Rose DeMarco. She is a pharmacist specializing in breast cancer and cancer treatment side effect management. In her free time, she likes to hang out with her 11-year-old nephew, Vinny, and her new niece, Evelyn. Rose is followed by Sameh Goma, a postdoctoral fellow at the Division of Population Science and Medical Oncology. He's interested in integrative medicine. In his free time, he enjoys martial arts and swimming. Finally, we'll have a demonstration by Mr. Robert Weiss, who has been practicing Tai Chi for 15 years. And he started learning at Fox Chase Library. When he moved to Center City, he learned the 24 movements Tai Chi and 32 movement sword form. He also does Qigong forms of stretching and energy work. In his free time, he likes to walk, cook, and listen to audiobooks. And there's me. I'm Amy Shaver, a mom who became a pharmacist and then got a PhD in epidemiology so I could do better research. And I'm here trying to improve the research process by reaching out to the community to let you know what we as researchers are up to and to find out what you as community members want. At the end of today's talks, we will have a question and answer period where you can call on any of the presenters to ask a question. I will also ask questions to get your feedback. There will be a sign-up sheet if you want someone to contact you. If you feel that you have more to offer and want to get involved in the research process, maybe you want to talk with a research team and offer your insights. These people are excited to meet with you and hear your thoughts. With that, let's get started.
We can try again. Good afternoon. Hello. I'm Leila Mahdi. I say Mahdi like body, so you can remember that. Thank you, Amy, and the whole group at the Cancer Center for having me today and the chance to hang out with you for a little bit. So I am a cancer doctor, but I also am a finance major back in the day. And so my research now kind of blends the two. And just talk
Can
about
you guys hear her okay in the back? Okay.
Yeah. I've always been told I need to speak louder, so I'll practice that today. It's been fun to blend both my passions into this work. So what I study is something called financial toxicity. And that term applies to cancer, but also all sorts of other chronic diseases. So the phrase financial toxicity was created to capture that the side effects of cancer care, like the costs of cancer care, can be just as bad as side effects from chemotherapy, radiation, or other drugs that we give for cancer. And that's what the term financial toxicity means. And what we've learned is that this idea of side effects from the costs of care is not just something that happens in cancer, but happens across a lot of other diseases that require you to go see your doctor pretty frequently. So what is the actual definition? It's the objective, what it means out of pocket cost in your bills and your healthcare claims, and the subjective, meaning how somebody actually feels from that burden, patient level impact of the costs of cancer care. It feels like a ticking time bomb, basically. So, the idea of financial toxicity, it tries to capture how poor health outcomes can come from basically your financial burden. And I like to think of it as this concept of opportunity cost, this tension between opportunity costs. And what an opportunity cost is the price you pay, in a sense, for a decision that you make that involves giving up something else to make that decision. And so it's kind of a hard thing to conceptualize, but things like missing work days or your high medical expenses that come out of going to the doctor, and all of the consequences like having less income are all of these opportunity costs that come out of having to go get cancer care or anything, diabetes care, heart care. So the way I like to think of opportunity cost is, let's say you decided to go to happy hour instead of working, for that hour. You would have made basically $20 if you decide to stay. If you decide to stay and work, you would have made $20, but instead you decide to go party with your friends and have a drink, and you spent $10 on that drink. So your decision to go party actually costs you $30, not just $10, right? Because you're giving up that $20 that you would have made. And so this is how to think of opportunity cost. For somebody to go to a doctor's appointment, they're maybe giving up a half day of work, right? So that cost to go to the doctor is not just now your copay, right? Or whatever you pay for that doctor's visit. It's also the amount that you gave up to get there. And so everything that we do, every decision involves some sort of trade-off. Trying to advance. There we go. And all of these trade-offs and financial burdens can take a really big toll on your health and your well-being, your happiness, and how you feel. And there is really good research that shows these burdens, financial burdens, can actually give you symptoms like anxiety and depression, higher pain levels, higher symptoms from what disease you have, and an overall lower quality of your life. So these are real things that happen physically from the burden you might have financially. And so who cares, right? I mean, it's like, well, you got to go to the doctor, you have a bill, you have to pay for it, right? Who really cares? The reason we care is because it actually is a matter of survival. The relationship between feeling worse, having worse symptoms, your lower quality of life, being depressed, having anxiety can all impact how long you live. And there's been, again, really good research that shows cancer patients in particular have a 2.5 times higher chance of declaring bankruptcy. And those people who do go bankrupt have an 80% higher chance of dying. I mean, that is incredible. That's huge. And so these are real side effects from financial burden. And that's why I think it's so important to understand this concept and why there's so much wealth in your health. Basically, there's payoffs to being healthy. So, you know, where does all the money go, right? You make money and you have expenses, and what happens? And so it's this cycle of, you have higher medical payments, you have higher bills, you have less income because you're going to all those doctor's appointments, you're taking time off from work, you might have to be disabled for some amount of time, or even long-term disability from whatever cancer or chronic disease you have. And all of that feeds into this distress that you feel from that tension between not having an income, not working as much, and having higher medical bills. And this is not just for you as a patient, but also your caregivers, right? Your caregivers, your friends, your family also have to give up some of these things to help bring you to appointments or to help arrange your treatments. And so this is something that doesn't just affect family, doesn't affect just patients, but also their families. And so what do people do? You know, all the things we love to do, traveling, you know, those get cut out. Even things like medications, you start cutting down on meds or taking them not the way you're supposed to try to, you know, use up less of them because you can't afford, you know, to fill your prescriptions. Or even, you know, you have to make a decision between paying your bills, right? Actually paying for the gas, the heat, a car bill, and your medical bills. And so this is going back to that this problem doesn't just affect patients, but it affects families. And so this is, you know, I think of it as like a domino effect. You know, it's not just the patient that ends up having problems with their symptoms or depression or well-being, but also caregivers can experience the same side effects from those financial burdens. And this is not just a problem for people who don't have insurance. I think that's a really critical and important thing to know. And what we know is that this problem can even impact all the way from childhood. So we looked at infants who basically have a breathing tube, and this breathing tube is required for longer term, longer than a year or 2 years. A lot of times kids who have other maybe disabilities or brain disabilities and other chronic medical problems might need this breathing tube. And so we looked at kids who had a breathing tube, and 96% of their caregivers, right, their parents, their caretakers, 96% of them, so basically almost everybody had insurance, and yet from that group, there was a high rate of severe financial toxicity, right? And caregiver burden. And so what we found is that families had to dramatically change their lifestyle, like changing, selling their house or selling their car. And a lot of patients have to dip into whatever savings they have to pay for all of these bills and pay for the things around that, going to the doctor and the medical equipment and the prescriptions. And so we take this concept and then looked at also adults. So again, I'm a head and neck cancer specialist. So we looked at this problem in head and neck cancer patients. And again, in a population that is mostly insured, 62%. So most patients have to dip into some sort of savings, get loans, borrow money from friends. And again, these are working, you know, insured individuals. And so what we see is that it doesn't just end when your cancer treatment ends. You'd think, okay, I got through this period, and then that's just going to be the hardest time. And that's not true. And when we look at head and neck cancer survivors, we see that they can have these high expenses that just continue and actually get more over time. And I think a lot of this is related to the support services that you have to have after you get treated with cancer, and sort of the side effects that you're left with and the things that you have to deal with from a side effect standpoint of your treatment. So sure, you're cured, right? But now you have all these other things that you have to deal with. And we saw that even 10 years, a decade out from people who were treated, they had, average expenses of over $600 a year. And maybe that doesn't seem like a lot, but 40% of our American families can't cover an unexpected cost of just over $400. So this idea of, $600 or $700 a year, even 10 years out from treatment, is a pretty big deal. So there's a couple things that can protect you a little bit more. So age and money. So the older you are and the more you make, the less likely you are to feel this burden. And that makes sense, right? The older you are, you probably have more savings. And the more you make, the more you can tolerate a change in your earnings. But at the end of the day, what do we do about this, right? There's so many levels that this problem can be tackled, health policy, insurance, patients and their families, or even employers, and the issues around employer insurance. And so it's kind of overwhelming, right? But what you can do as a patient is actually initiate conversations. And again, this is not just for cancer, but if you have any sort of concerns about maybe the finances around your care, it's important to bring that up. And I'll admit, as doctors, we're not always really good about answering those questions. Most of the time, we're clueless, just like everyone else, about the actual finances regarding care, but we can at least connect you with the right resources, or start to connect the right resources. And most patients, when again you look at research, actually want to have these conversations with their doctors, but sometimes are afraid that it'll change their treatment plan, or their doctor will think differently of them. And in the end, really just talking about this stuff can actually lower your costs without ever changing your treatment. And so you can be your own best advocate when it comes to this, and actually bringing this stuff up to your doctor. And so these are a couple of other different resources that have to do with financial toxicity through cancer support hotlines. And with that, I just want to thank you for your time.
Sure. Do you need a note for speaker? Notes. Yeah, I guess I need that. Sorry, give us 1 second. Technical difficulties. I'm sorry. Oh, yeah. Medication safety, right? Okay. I think we're all set. Yeah. Sorry about it.
Okay. Okay. So hi, everyone. My name is Rose. I'm a pharmacist at the Cancer Center, the Sidney Kimmel Cancer Center at Jefferson, and I am here to continue the conversation about advocating for yourself in your health by talking a little bit about medication safety. Can everyone hear me okay? You can't really, okay. Okay. Yeah, okay. I'll try to be louder. Just scream. Okay. So as we age and develop different medical conditions or diseases, we are more likely to take multiple meds, right? I'm sure a couple of you in this room are taking more than just one medication. So where do these medications come from? They are prescribed by our healthcare team. They might be over-the-counter medications, and they also might be vitamins or herbal supplements. So just a little bit of research, 44% of men and 57% of women over 65 are taking 5 or more medications per day. So that's a lot. And then to take it even further, 12% of all people over 65 are taking 10 or more medications per day. So that is a lot of pill bottles, that's a lot of money, and that's a lot of side effects, right? So how does this happen? Well, when we have different medical conditions or different diseases, you will inevitably get different medications to treat them. And then you might have different providers that you're seeing that are prescribing meds. You might be taking over-the-counter meds or other vitamins, and you're maybe not telling your healthcare team that you're taking them. And then if you have cancer, our cancer patients usually need even more medications to help with side effects that their cancer treatments might cause. So why do we care about this? Why am I here telling you something you probably already know, right? That you take a lot of meds. Well, more meds equals more side effects. And that can be a problem. About 35% of patients over 65 will have at least one medication side effect per year. And, we think that number is actually a lot higher. We think that maybe side effects aren't always being reported, especially if they're, minor, maybe not so troublesome. So that number could be even closer to 90, 100% than we might think. But what's really important is about a third of those patients will be hospitalized for that side effect. And nobody wants that. So what are our common medications that cause side effects? Basically all of them. But when I think of the ones that are the most problematic, I think of our blood thinners. So those are the meds that you might take to prevent a clot or a stroke. Our water pills are the meds that you might take to get rid of any extra fluid that's in your body. It causes you to pee a lot, and sometimes that can cause dehydration, which can lead to side effects. Pain or anxiety medications are very important, but can also bring with them a good amount of side effects. And then any type of heart or diabetes medication can also have a lot of side effects as well. So another reason why multiple medications are a problem are because of drug-drug interactions. So basically, different medications might interact with each other, making them either more toxic, so more side effects, or they might not work as well. And if you're in the hospital, this is something that your pharmacist is looking at. And at your doctor's office, we are lucky enough to have a lot of electronic resources that help us with these drug interaction screens. But also important for you to know. So some examples are pain or anxiety medications. If you take them with allergy meds like Benadryl, you might have more side effects like sedation or sleepiness. Another really common side effect that we don't talk about enough is any vitamin that has iron or calcium can actually make your antibiotics stop working. which is not good if you have an infection that we need to treat. And then St. John's wort is a popular over-the-counter medication used for a bunch of different things, but it interacts with basically every med out there. So we recommend not taking that, but I don't think we talk about these drug interactions enough. And then kind of on the flip side, different drugs might cause your disease to get worse. So some examples of that are ibuprofen, which is common in Motrin or Aleve. That can actually make kidney disease or heart disease worse. And aspirin, if you're taking aspirin and you have a history of stomach ulcers or an active stomach ulcer, you can have more bleeding. So these are all reasons why we want to keep a close eye on what medications you're taking, even if they're over the counter. So medication confusion. If you're taking a bunch of meds, it makes it really hard to keep on track, to remember what you're taking, to remember the instructions that we gave you. Not every pill is take one once a day. Sometimes there's multiple pills per day. Sometimes there's multiple days and then you stop. So all of this can get really complicated the more meds that we add. And if you're having problems taking your meds, that can lead to either more symptoms of the disease we're trying to treat, more side effects, or ultimately more hospitalizations. And then finally, increased healthcare costs. So the more meds we add, that's more copays because you're going to see the doctor. That's more office visits. Maybe we're getting labs, all things that you sometimes need to pay for. And then you might end up in the ER or with more hospitalization. So that's kind of why I'm here to talk about medication safety. These are all the things that can happen if you're taking too many meds. So what can you do to keep yourself safe? You know, diseases happen, medical conditions happen. We know that we need to treat them. So how can we do this safely together? My number one tip for you is to ask for a medication list. It is the easiest way to keep track of everything that you're taking. And your doctor, your nurse, or even your pharmacist can print one out for you. You can also make one yourself. I have these handouts that we have outside with a template of how to make your own medication list. Because it's really helpful for not just you, but for your care team when you have one of these to direct your therapies. So it's really important to make sure that this list has your doses and it has when to take each medication, when it's in whether the morning or at night or with food. You want all this information on that list. And if possible, you want your doctor or your care team to tell you why you're taking these meds and write that on the list as well. Any types of over-the-counter meds, vitamins, supplements, sometimes teas, if you're getting like a tea blend, that should be on the medication list as well, because your care team needs to know that information. And even if you only take it every now and then, that stuff's really important for us to know. Bring this list to all of your appointments, hospital visits. Sometimes even your dentist needs to know what medications you're on. So good idea to kind of carry this with you. And then when a new medication is prescribed, ask your doctor or your nurse practitioner, whoever is prescribing, to take a look at your med list and see if anything needs to be adjusted. And if possible, to give you a new list. You can also ask for a list of your medical conditions. This can be on the same list if that's what you like, but this is really helpful because when a new medication is added, you really want your care team to look and see what you're already taking for the conditions that you already have and make sure that nothing is interacting or could even make something worse. And then again, every time you receive a new diagnosis, get your healthcare provider to add that to your list. This is just a picture of the list that I have on the handout for some examples. So really important, again, to have your dose when you're taking it. And even this has a little box that you could say what kind of form it is. So is it a tablet, a capsule? Is it liquid? How much liquid? So things like that that you might want to know. So advocate for yourself. I also have these questions on the handout if you want to take this with you. But you are your biggest advocate. So let your healthcare provider know your questions. They want to talk to you. They want you to be a part of your care. So when a new medication is prescribed, the number one question you should ask is, what's this for? What is this med treating? How long do I need to be on it? When do I take it? Are there any interactions with my current meds or my current medical condition list? What side effects should I be aware of? And if there are side effects, how do I manage them? When do I call you with side effect questions? And another question that I don't think we ask enough is, can any of these medications be stopped? So sometimes as you are, kind of working your way through a medical condition, medications might be added that could actually replace something that you're already on. So really good idea to ask, now that you're adding this new pill, which one can I get rid of, if possible? And if they say, yeah, stop that med, you don't need it anymore, always double check that you can stop it right away. So stopping a med without a proper taper, if it requires it, can cause a lot of side effects as well. So a great question to ask is, okay, sure, I am stopping this med, but over how long should I taper it off? What's the deal with that? So definitely ask that question of your team. So what do you do if you have additional medication questions? And now this is where I get a shameless pharmacy plug. So ask your pharmacist. We are super trained to be experts in these medications. We get about 6 to 8 years of school to learn about meds. And then depending on your specialty or where you kind of work, you might get more training. So for me, I specialize in oncology or cancer. And then even further, I specialize in breast cancer. So I had a lot of training for that. We have certification tests that we take. And even still, I'm able to answer questions about heart medications, diabetes medications. That's just how we're trained. We can answer interaction questions. It's kind of one of the most popular things we do. And we can give a lot of education on side effects and how to manage it. I do want to remind you, though, that pharmacies can be very busy. So if you're going to a CVS or a Walgreens, I'm sure you've waited in line for your meds to be filled. So sometimes not the best situation to ask questions to the pharmacist. I suggest scheduling a time with them, maybe when it's less busy, so that you can come back and get their undivided attention. Because we truly do like answering your questions, but when the phones are ringing and people are waiting in line, it's not usually the best kind of situation to do that. If you're in the hospital, any order or medication that your doctor prescribes in the hospital needs to be verified by a pharmacist. So there's always a pharmacist available to answer your questions if you have them. And then as for the doctor's offices, different practices have different setups. Jefferson has a good amount of pharmacists in clinic in the diabetes and the heart disease sections, not so much in cancer just yet. I'm kind of the only one. But no matter where you go, there is someone who can answer your questions. And I just have a list of references here. So please grab one of these handouts on your way out. It has all the information that I have on my slides, and I hope they're helpful for you. And then after this, we can talk a little bit more if you have any questions about your medications. Okay. Thank you guys for having me.
Is this like the regular view?
Click here. Yeah. down there.
That works. That would be fine, as long as it turns.
Okay, let's see something real quick. I just
Yeah,
wanna
that's
make sure. It's not bad.
Cool. Well, thanks everybody for attending the presentation. We're really excited, like as a researcher, to share. Okay, I'll make it a little bit louder, to share our research with the community. So the presentation today is called Tai Chi for Health Benefits. First question is, what is Tai Chi? So Tai Chi is an ancient Chinese martial art form. It flows from one different form to the next. Tai Chi has multiple different forms, of course, so they range from 20, there's 40, there's 100 forms, and there's much more. It depends on what kind of target that you want to get out of Tai Chi. So one form flows into the next until you're done with the whole forms of Tai Chi. And the main aim is really to integrate movement, breathing, and meditation together. So this slide has the most common form, which is the 24 forms of Tai Chi. As you can see, there's multiple movements that you do that one flows into the next. And when you're practicing, you're trying to add the breathing into the movements as well as the meditation movements as well. So why would you want to practice Tai Chi? Multiple research studies have been done before, and we have seen multiple benefits for people who have been practicing, like decreased stress, improved mood, improved aerobic capacity, where aerobic capacity is how much exercise you can do before you become winded. Also, we have seen increased energy and stamina, increased flexibility and balance and agility, improved muscle strength, enhanced quality of sleep. Some studies have been made to see Tai Chi improving blood pressure with medication and without medication, improved joint pain, improved symptoms of congestive heart failure, and overall well-being, plus actually the benefits that you get when you socialize with fellow practitioners. So a lot of benefits that you can get out of Tai Chi. So hopefully we've like listed all the benefits and you're considering doing Tai Chi. So can you practice Tai Chi? The answer is for the most part, yes. It's a very easy form of martial art, and it's actually just as you've seen the benefits. It's not really difficult on your body. It's a low impact exercise, and it just puts minimal effort and stress on your muscles and joints. It doesn't require like any special equipment, and you can practice anywhere, indoors or outdoors. But I would, if you have like certain health problems like joint pains, if you have chronic disease like chronic musculoskeletal disorders, I would talk to the doctor first before doing the exercise. And the main idea is just to see if the forms can actually work for you, and if there's any modifications that you do. Some of the forms, as Mr. Robert Weiss will do in the demonstration, will require you to have a little bit of a stretch. So you need to make sure that it is just safe for you if you have any kind of the like musculoskeletal disorders or joint pains or problems. So why do I have to talk like about Tai Chi? How do I know like for a fact that it is good for some patient populations? We had a research study at Jefferson. So we had some breast cancer patients who are on aromatase inhibitors. It's a kind of medication that stops the cancer from coming back. But aromatase inhibitors, unfortunately, do have some side effects. One of them is joint pain. It increases hot flashes, can have increased depressive symptoms. So a multitude of side effects. So the idea we had is, can we use Tai Chi to prevent these side effects or actually reverse these side effects? So we did a Tai Chi study. We had about a few patients there on the study for about 12 weeks. They did Tai Chi classes over Zoom, and we wanted to see, will it improve like joint pain? Will it improve their depression? Will it improve fatigue, their sleep quality, and hot flash symptoms? They had any of them. So that's like a picture of some of the classes that we had. I'm really sorry for my photo editing skills. Not really an artist, so the first couple of pictures is Mr. Weiss. He was doing the classes, and then we have a few of the practitioners, practitioner women, really dangerous ladies that were doing the Tai Chi. So the results that we had was actually surprising even for me. We had about 55 patients that we tried to reach out to 55 patients. 39 actually joined the study, and about 60% of the patients attended one class, at least one class per week for the 12-week period. And about 22 of the participants actually finished the studies, done all the surveys. And after 3 months, we have seen improvements in joint pain and functioning, improvements in depressive symptoms, improvements in fatigue, sleep quality, and hot flash symptoms. And actually, some of the input that we got from the participants, one patient said stiffness and pain decreased. At some point, I felt joints in the knees and elbows move back into my sockets. I'm more limber and able to lift my knees higher to run faster and further. Another patient said within 2 weeks, I had relief from the joint pain, especially my shoulder pain. Another participant said, I particularly like the breathing exercise at the beginning, and I will continue to use it for relaxation and mindfulness. And lastly, a participant said, my flexibility and balance has improved. So we've seen multiple benefits, both anecdotal and in statistical, like using statistical methods. And I really urge you to add some Tai Chi into your life. I think the senior center here has a program, and Mr. Robert Weiss does the classes here. So introduce some Tai Chi in your life. And thank you so much for the presentation. I think Mr. Weiss will do a live demonstration of the 24 forms. It's a few minutes, so stick around to see it.
Very like. That's what we. Follow you though, where you're watching with stand up a little bit.
Well, I don't know if you have a room to do that. Why don't I just show it to you? Tai Chi is about balance and control. And as you step, you shift the weight. So I'll just give you a demonstration of it. We start out, step forward. Begin the form. Breathe in. Breathe out. Sink in. Hold the ball. Part the horse's mane left. Part the horse's mane right. Part the horse's mane left. White crane spreads wings. Brush knee left. Brush knee right. Brush knee left. Strum the loop. Repulse the monkey. Once. Twice. Three times. 4. Hold the ball. Grasp the bird's tail, left. Ward off, left. Roll back. Press. Apparent close-up. Push. This is breathe in, breathe out. Turn. Hold the ball. Grasp the bird's tail right. Ward off right. Roll back. Press. Parent close up. Push. Single whip. Wave hands like clouds. 1, 2, 3. Single whip. High paddle on horse. Right kick. Box ears. Turn. Left kick. Descending single whip. Golden rooster stands in left whip. Descending single whip. Golden rooster stands in right whip. Fair lady works the shuttles. 1, 2. Needle C-bar. And through back. Turn. And chop. Step forward. And punch. Apparent close-up. Push. Turn. Cross arms. Feet together. And Tai Chi.